I've admired Mark for years, and when we first started FSG, he said, you know, there's so many consultants in California, why would we need your firm to come out here? So about 4 years later, when we had breakfast and he proposed hiring us, I was particularly pleased.
California HealthCare Foundation tries to be a catalyst to improve health in California, and in particular to improve the affordability of healthcare.
They had a mission of improving healthcare for Californians, and that's great. But what that actually amounted to in terms of a concrete change they were trying to bring about wasn't clear.
And that's where the PRI thing is part, not all.
We often ask a client, if you're successful, what will be different 5 years from now? And most foundations can't answer that question, because while they're funding individual programs, each of which is good, they don't necessarily add up to a real change in the world.
We were asking them to come in and help us review the previous 5 years of our work and be better about being explicit and clear about what we were going to try to do, how we were going to articulate it, and in particular, how we were going to measure our effectiveness. We, like many foundations, have had mixed history with consultants who may not understand the nuances of the board, the nuances of the staff. It is not, I think, uncommon in foundations for strategy to be largely driven by staff with kind of a sign-off by board, most of whom are neither philanthropy professionals nor often, at least in our case, professionals in healthcare. And so there's always a bit of a tendency to defer. And they said, yeah, that's fine, but we really want to own the strategy, we want to be involved in it. And so the board was the client. I got nothing but good things to say about how FSG handled, I think, all of those tasks. We're no longer going to work on availability, especially in dental care, on its own.
Out of our work with California HealthCare Foundation, they came up with three basic goals or areas, one of which had to do with innovations for the underserved.
We are trying to push the healthcare system to adopt some of the kinds of technology and business models that makes services better, faster, and cheaper.
The second one was about better chronic disease care.
Whether that's hypertension or diabetes or HIV. And then our third area is what we call market and policy monitor. And again, all three of these were developed with FSG. And that's essentially our transparency work.
Part of what came out of this process, and really one of the second outcomes, was a much, much greater alignment within the board and between the board and the staff about what the foundation was trying to do.
What you see on our website in terms of the things we do and the way we describe them were largely the product of that engagement. We've reaffirmed our desire to judge our effectiveness in all those areas. That was the final product.
It's really changed how the foundation operates and how they hold themselves accountable.
We've actually done other work with FSG more recently around how the whole state's healthcare system will get wired and will get electronic and will get modernized. They were really pivotal and did an excellent job in helping to manage a complicated process in an area whose technical subject matter is not really in their domain.
We don't, pretend to come in and say we know more about healthcare than they do, but we're able to really help the staff use their expertise more effectively. To be able to take such a high-performing foundation and make it even better was deeply satisfying.